he mentioned, I'm a professor at the University of Pretoria. My field of expertise is in ear and hearing healthcare. I'm also a co-founder of the EarX group and a scientific advisor to this group who really specializes in providing affordable access to ear and hearing healthcare using digital solutions that anyone can use anywhere. So that's just a little bit on my background, and so I'm going to open it up to the panel. Maybe we can start right here.
Sure. Hi, good morning everybody. My name is Sunil Kent. I represent Click. So Click operates in the visual analytics space. I've been with Click for about 6 years now. I'm based in Dubai and I cover the Middle East and African region. I wouldn't say I'm a healthcare specialist, but I've worked with lots of different healthcare systems and countries that are operating sort of healthcare facilities and private hospitals. I'd say I'm more of a data guy and a technical guy, so I can speak a lot about data, not only in the healthcare industry, but lots of different industries as well.
Good morning, everyone. Name is Dr. Sushant Pillai. I'm the Sales and Marketing Executive at Meditech. At Meditech, we deploy healthcare solutions that kind of traverse all the layers of healthcare, primary, secondary, tertiary, quaternary, clinical background, went through the technology baptism, strong crusader that technology is a strong catalyst in improving health outcomes. Right?
Morning, my name is Sharan Amon. I'm the founder of a health tech company called Recomed. We started a couple of years ago to be the first online healthcare booking platform in South Africa that reached scale. We managed to get there. Everybody thought that consumers weren't really ready to start using their smartphones and the web to start interacting with their healthcare providers. Things were going to stay with phone calls and paperwork. We've kind of proven over time that that's not true. So currently we have 1,500 healthcare providers, contractors accepting online bookings, and that's used by, our platform's used by about 100,000 unique South Africans every month. And we're integrated with about 80% of practice management application providers in South Africa. And just on the topic of analytics and data, we're sitting on this mountain of data that we've seen from user behavior, and it's fascinating to see how it's being used by our customers in the industry and how it's not being used as well.
Good morning, everybody. I'm from IBM Research, South Africa. I'm one of the research scientists working in the data-driven healthcare team. Actually, I would like to take this opportunity and invite to the new lab which was opened in the continent, African continent. This is the 13th lab in the African space from the worldwide, and especially we started last year, and mainly we are focusing a lot of problems which are African in the healthcare space. They are mostly data-driven healthcare. I'll discuss more in detail what are the problems, what kind of problems we are addressing in the cancer treatments and the diagnosis and the problem prevention and the TB. Tracking the spread of devices. Thanks.
Thank you for that introduction. I wonder if we can start off with a question. Sharan, you mentioned the mountain of data that you're sitting on. So yes. I think maybe if we can just kind of get an impression from you, what potential do you see in harnessing available data to improve the clinical and organizational outcomes and performance in health?
Well, I really see unlimited potential in terms of where we currently are as a country. There's kind of global health, and then there's a South African system, which I think is very sophisticated, particularly clinically, based on what we see. I'm a computer scientist. My parents are both doctors. They're fantastic doctors, very poor on the computer science. And I hope it's not representative that there's 4 Indians sitting on the panel talking about data. Woo! Nonetheless, so in a typical day, we'll do a couple of thousand online appointments, and we'll sync maybe 10+ thousand from all our practice management providers that we integrate with. It's a lot of data, and you add that up, you end up with terabytes of information over time, which is really the big difference between big data and analytics. Big data is a freeway with 9 lanes, and analytics is kind of a bicycle path in a nutshell. It's about scale and size. I think that there's massive opportunity for direct workflow comparison. So in our space, we can have a group practice with practice locations around the country that materially compares times of individual practitioner busyness on a day-on-day, year-on-year, month-by-month basis, because all the information is available. We could see things like disease trends, flu, HIV, etc. And we can analyze this in a very secure, robust way. You did using anonymization so that we don't actually attach the personal information to the record, but we can see very meaningful trends, and this can affect things like capacity planning for this particular customer of ours, making sure that the right treatments, machines, etc. are available. It's good to know, for example, that on Monday mornings there's a lot of insurance medical bookings coming through into a particular facility of one of our customers. Therefore, they need to be ready for that. So that's low end and high end. Now, the bigger issue, I think, and I'm not going to comment too much on the clinical side because I'm not a doctor, and I find that the doctors really know what they're doing on the clinical side, to be honest. That's been our experience. And in fact, if we look at healthcare industry at large from a business perspective, I would say that medical practitioners and professionals represent a large swath of the executives. So the clinical side's good. In my experience in this country, the operational and data intelligence side is incredibly poor. So I think that in addition to just seeing the odd insight, what we have is a culture where reporting is important. Let's see the report. It goes up to Exco. They like it. Good. Let's keep going. Let's keep getting more patients. And for us, the primary selling point of our platform at Recommit is increasing visits for doctors, and they like that. But what about all the other insights of improving patient experience and improving your operational delivery? We see very little interest in general from our customers who we love and we want to help in those two things. And I don't think it's because they don't care. I think it's just because they're focused on volume and on clinical delivery. So personally, beyond just a culture of reporting, I think what we need is a serious culture of data analysis. We need to take it seriously. I think that platforms like Click that Sunil has, we work with a similar company, are fundamental to success in organizations dealing with data. Frankly, otherwise no one can understand it. And beyond that, I think that each team inside an organization, there shouldn't be a data and BI team that comes in from the ivory tower and says, we've got the following insights, go and use them, because they don't actually get implemented. Each team needs to have data analytics as part of its culture and needs to routinely review and act on stuff on a quarterly basis. And then you get this Kaizen improvement approach going on in the company. I don't see enough of that, personally. But in terms of a potential, well, what's the value of incremental and insightful improvements over time, and things that you literally couldn't see yesterday that you can see now? I mean, the potential is unlimited, and I can give countless examples of it.
Thank you very much, Aaron. I think one of the things that stand out from what you said is that health informatics at the moment seems to be poor still. I mean, it's not where we want it to be. So maybe I can ask you, Susan, I've got that right?
Getting close.
Okay. I just want to ask you to maybe comment on that. You've got experience in electronic health records and software solutions in health. What actionable outcomes are we starting to see, if any, from these growing data health repositories?
To start off, let's kind of understand, who's the actual end user in this healthcare ecosystem. It's the patient, right? And the personality of this patient has really changed over the last 15, 20 years. I mean, we've moved from a provider-centric to a patient-centric environment. The appetite for on-demand services from this patient has changed. There's a lot of focus around data convergence using smartphones, like my colleague said, booking appointments through your phone, etc., etc. Now, when you have this next generation patient come to your office, right, he is now posing the question to you as a clinician, what will happen to me tomorrow? What will happen to me the day after tomorrow? And we're doing a lot of interesting stuff to now bring in business intelligence, but bring in the layer of predictive analytics, where you start to model the data based on various patterns and trends, and bring in not only data from either from your EHR, but start to extend the reach of the data to the healthcare ecosystem, start bringing other environmental data sets. I'll give you a typical example. If you look at sepsis, for example, sepsis is perhaps one of the leading causes of hospital death globally. I think in North America, if I remember correctly, it's 1 million sepsis cases occurs every year, and it kind of accounts to 250,000 deaths. That's from a US perspective. So what we have done, from an EHR layer perspective, is that we have built in sepsis algorithms in the back end of the EHR. So now when a patient comes in, the patient is put in the ward, your orders for labs are placed, the results are normal. As that starts to occur, that intelligence in the back end starts to kick in and starts to kind of coax the doctor to say, there is a susceptibility or high probability that this patient could end up being a sepsis patient. I mean, that's a typical example, just an example I'm giving you with regards to what we're doing from a clinical perspective. We're also doing quite a bit of work with other vendors, IBM to say that one of them. I mean, we're doing a lot of work. I know you will touch on it, but with Watson, I mean, the work that's coming out through Watson is phenomenal. From a Meditech perspective, I mean, we extending the reach of data analytics, and Dr. Poe mentioned it a bit earlier. We kind of we're moving into the realm of population health. All right, and that's when you have multiple systems. You have the interoperability layer. They talk to each other. That's the ideal world. That's the ideal world. But once that happens, for you as an organization, for you as a provider, you get a better understanding on what's happening in your population or in your district. I'll give a typical example. I don't want to spend too much time. I'll give you a typical example. Now, you look at Botswana now. The Ministry of Health Botswana runs one singular longitudinal health record that covers 2 million people. There's no other extrinsic data elements. It's one singular electronic health record. Now, when a malaria outbreak, for example, happens in the northwestern region, say in Maun or by the Delta, we have put in indicators in the back end that immediately starts to flag and alert individuals back at the ministry to say that there is a higher predisposition, or there's a high probability that there could be a malaria outbreak during the season because we have seen an increase of patients that's coming with certain signs and symptoms at the primary healthcare level. So I think there's a lot that can be done from a clinical perspective, and I think once we start to show that to the providers, especially the doctors, I think the impact it has on patient and health outcomes is enormous.
Great. Thank you very much for that interesting perspective and also for the examples. I think that's useful to see how we can actually leverage this data. You did mention in the ideal world we see interoperability, data systems talking to each other, integrated. I wonder if we could have our colleague from IBM maybe comment on that for us, because the question is, in our siloed information systems, which really is the reality at the moment still, at least in South Africa, how are we going to make things like big data, predictive analytics, cognitive computing work for us across these siloed systems?
Actually, basically in our lab, we are focusing on 3 major key issues addressing the South African and the African continent, and we are scaling up to the other different continents. Mainly here we are focusing on genomic medicine, which will leverage the genomic information for the personalized medicines, to develop the personalized medicines using the genomic information. That is one area, and we are building the molecular mechanisms in understanding cancer, which spreads to the different parts of the body. Because most of the people with the cancer, most of the people will die, 90% will die if the cancer spreads from one part of the body to the different organ. So we identified from our lab, 4 discoveries, 4 genes, which will which will identify the metastatic genes. So suppose if you have breast cancer, it will move to the brain or lung or different organ. So once you identify those genes and targets with the new drugs, then most of the people will survive. And especially in African space, they saw the potential. So that's why we are working mostly with the cancer reporting, reporting the cancer statistics and analysis. And other project we are working on, like South African government national health laboratories has got huge amounts of data, very vast amounts of data regarding the HIV, cancers, and we partnered with the national cancer registries. They got 5 years lag time in reporting the cancer statistics to the government. So we are building the cognitive platform in order to address this issue and bringing the 5-year lag time to the month's time. in a month's time. So actually we'll get a lot of pathology reports from the different labs. So in the initial cancer registries, there are human coders will be there. They will, from the reports, they will put the data into the system by manually, by seeing the reports and taking the data and putting into the system. What we do is we are doing a lot of analytics, modeling, analytics and visualizations using the cognitive platform. Like we are using AI, deep learning, machine learning, video, audio and image-based processing to extract the information from the text-based pathology reports. So most of the countries in the United States, 19 labs or 19 cancer hospitals, they are using mostly the medical image-based analytics. From this side, we are using text-based analytics. Like from the text, we will extract the information using the natural language processing. We will understand the data from the lab reports, what exactly we'll extract the patient problem, treatment, diagnosis, biomarkers, which will help in designing the new drugs for the similar kind of patients. And for example, we observed like males has got the breast cancers in the South Africa. You know, most of the people they don't see. So those kind of data we are getting, and we are doing a lot of analytics using the cognitive systems and building the visualization dashboards in our lab. And other project we are working with, we are getting a lot of data from. We developed the tracking devices to track the disease which is spreading in the community. Like we are focusing on the tuberculosis, which is so we want to identify the potential hotspots areas using the geographical information and the person who is spreading the TB in the communities. So that is the main thing. We developed a new low power, low chip in our lab. We are scaling up to the new different hospitals now, and it will identify the person who is really spreading the TB in the community. So these are all the projects, and we saw a lot of data coming up, and we want to see the new ways of prevention, treatment, diagnosing and treatmenting and managing the data in the Africa. That's what I can say from now. And one more thing is, I want to address, we are bringing the vaccine for oncology to the country, South Africa. Especially we spoke to a lot of oncologists around the continent, and a lot of information is there. Then hardly 30 or 31 oncologists are there in the continent. So, and it really solves the problems in the cancer treatment. We are preparing already, we started preparing the guidelines for the different countries in Africa.
Thank you very much. I think that was a good overview, and especially I think the focus on cancer, using big data to see how we can do predictive analytics there, and treatments as well. That's part of that. So maybe I can just quickly share, maybe that was on a macro level, but also on a micro level, how cognitive computing can support clinical diagnostics on the ground. You know, the work that we've been doing over the past couple of years has been to see how can we improve diagnostics for ear disease. Ear disease is one of the most common conditions that young children present with. In fact, it's the second most common condition that a young child ends up in a physician's office for. It's often misdiagnosed, and in reality, it's very difficult to get someone to actually do an accurate diagnosis because of a shortage of specialist healthcare personnel, etc. So over the past few years, we've been working on how we can use image-based analytics to actually train machine learning algorithms to diagnose some of the most common ear diseases, acute otitis media, chronic otitis media, etc. And we've now developed this system, published it in a couple of peer-reviewed international journals that shows that it's possible to provide diagnostic support on the ground if you use a digital device like a smartphone, connected to a smartphone otoscope. You take an image of that eardrum, you upload it to a server, and you can do those analyses there. Literally a couple of seconds later, you can send back a probable diagnosis. And our accuracy at the moment is about 86%. So I think that's just an example on how, on a clinical individual level, cognitive computing can also assist and support diagnostics on the ground, especially when we don't have the numbers of specialist hearing health or ear providers globally. So I think maybe on that level, I'm going to turn it over to Sunil, who really, I think, can give us a perspective of how we take this data and we visualize it in a way that's meaningful, but also that supports us in making timely decisions and acting on those decisions. So maybe if you can give us a little bit of a perspective.
Yeah, absolutely. And I think, that's the key question, really. I mean, it's all fair enough that we've got lots of different data repositories and we want to bring that data together, but how do you actually make it meaningful? How do you get the data to add some business value? And I think, visualization is a part of the picture, it's part of the whole puzzle, but it's just one part of it. I think what we're moving towards now is that visualizations, they don't just need to turn rows and columns of data into pretty pictures. They need to be smart. They need to understand how the user is interacting with those visualizations. They need to show outliers in the data. They need to lead the user on a journey in that particular data. And it has to do it in a user-friendly way, in an intuitive way. And the way we consume data nowadays is through multiple platforms. And I think if you look at the industry of the last 10 years, it's really moved on from sort of static PDF-type reports where people want to be able to self-serve and answer their own business questions in multiple different formats. So not just on a laptop, but smartphones and smart devices. They want to be able to embed analytics in lots of different systems and combine actual data with trends of what's going on to lead sort of business decisions that are going on. And I think that's really where the industry is going. I mean, and that's really been fueled by companies like Apple and Google, who've empowered us as individuals to be able to self-serve. If I'm sitting at home and I've got a question about a particular advertisement that's just come on the TV, I can quickly Google that. But the experience that you get back in your office is very different because if you've got a question about a particular business process and you don't have a report or a dashboard that answers that specific question, you have to go to your IT team. And that then takes 6 weeks to be able to get that report to you. And by the time the question is no longer relevant. So now where the market is moving towards is more, I as an individual, I want to be able to self-serve, I want to be able to answer my own business questions, and I want to be able to see that in a visually appealing way that shows me within split seconds what's going on in the business. And then we can move on more into sort of the advanced analytics and the predictive analytics. So I understood what's happened in the past now. I want to be able to diagnose why that particular thing happened. I want to then understand, okay, well now I understand why it happened, what's going to happen in the future, and how can that then influence my business decisions, my business processes, so I can change the business for the better.
Great. Thank you. I mean, I think that's an interesting area. I mean, we hear about the role of big data and the power of predictive analytics, but the visualization component is often the one that's kind of left towards the end, it's extremely important. So, can you give us some examples of how data visualization that's done in a way that's intuitive can really increase the efficiency, and maybe the outcomes in healthcare systems?
Sure, absolutely. So, I mean, we can take the topic of, for example, clinical variation. So, if you've got a lot of different sort of clinicians doing operations within a hospital, you want to understand what's the variation between those different doctors that are completing those procedures. And if you've got that data stored in rows and columns of data, it's very difficult to pick out the trends. But if you turn out those rows and columns into a visualization, immediately the human brain can process that a lot faster than scanning rows and columns of data. And that's where the discovery part starts, and that's where the diagnostic part starts, because once you've seen that trend in the visualization, you want to understand why that happened. That's just natural. That's why the way the human brain works. If you ask me a question now, and I give you an answer, naturally, you'll have your follow-up question there. And so the visualization needs to be able to then allow you to drill into that data, drill in to understand what are the root causes of that particular variation. So if we've got, majority of our doctors, prescribing and completing procedures and the patient stays in hospital for 5 days, but we've got a bunch of doctors where the patients are staying for 14, 15 days. What is that variation? What's the cause of that variation? Can I drill into it? Can I see the patient records? Can I see the diagnosis? What was the cause of that? And that's where you can really then change your business processes. Perhaps you can identify those particular doctors that are leading that particular, are causing that variation in the business.
Great. Thank you. I think we want to have a discussion around the challenges and some of the facilitators as we see this role for big data and predictive analytics come really to its own over the next couple of years. But before we do that, I'd like to open up to the floor for some questions at this stage. So if there are any questions, please, now is the opportunity. we've got a roving mic here. There's a question here in front, and I see one over there also.
This is to Sharon. My name is James. This is to Sharon or the panel. Data being one component of innovation in healthcare, what do you see as other obstacles to the healthcare industry as a whole adopting innovation across all variables across the industry?
Well, I think it was mentioned earlier. One big issue is interoperability of systems. No one is going to, and this is multiplied in a clinical environment where healthcare is on the line, and it's by definition a high volume environment. No one is going to want to adopt innovation that makes their lives more complicated and makes the workflow of their practices more complicated, and where the expectations placed on them, suddenly you expect them to learn a whole lot of new things, like how to write SQL queries. Someone in the company needs to understand that, for example, before they can act on anything. So let's just take those things apart. And that's fundamentally, I believe, what's made it difficult for innovation to be adopted. Now, if we look at the consumer side, and this I'm talking about from an industry perspective. Now, if we look at the consumer perspective, and that's been our experience at Recommend, from an industry perspective, the moment you put tools that work in consumers' hands, tools that work, and having them work assumes that the healthcare organizations have adopted and integrated them so that the consumers get a good experience. But the moment you do that, the uptake is incredible because of this world that Apple and Google have created where things are changing so rapidly. So consumers are not the problem. It's us working together that's the problem. Now, I think that we need a few key things. We need, first of all, and this links back to analytics, does the product actually work? So in our example, we have to prove quickly that we've materially increased visits for the practice and that 50% of the bookings happened after hours. Because they'll say, well, otherwise what's the point? We prove that quickly. You've got to tell them that. The second thing is you've got to have a tool or have a form of reporting in place where people can either inside the organization query the data that's going on, because it's just a big mystery. It's behind a total Chinese sort of wall, this mist where no one knows what's happening. And we've seen this consistently, that no one has any idea of what the numbers inside the organization are pertaining to key things. They kind of work on gut feel and hunches, which are frequently wrong. So unless there's very crisp, clear reporting coming from either the service provider or internally inside the organization that has a culture of finding this information for itself, then that loop is not closed. And then finally, fundamentally, you must work with workflow integrated solutions that don't have a net increase on the workload of the people inside the company. I think those are the three main barriers for all innovation in the sector, and routinely we come up against them. But if we address those things, there can be massive improvements, and that's really where you see the winners moving forward. I mean, we're in an economy now that's moving into a recessionary state. Yes, everybody needs healthcare, and everyone needs to see the doctor, and that's something we can all bank on and bet on. But it's competitive out there. We're in a fairly saturated market, and the people who pull ahead and win are the people who act on these insights and actually try new things, but educate new things, I think.
Great, thanks, Sharon. I think you mentioned the fact that the consumers are not the problem. The way the data is structured, the way that we handle the data is sometimes a challenge. I think maybe another challenge is also adoption, of innovation by the healthcare providers and the healthcare system. It's notoriously slow to adopt innovation. And there are some good reasons for it, but I think, there's also very good reasons to trial innovative solutions and really see what value they bring to the system. I don't know if there are any other comments from panelists.
I would just like to say that I think it's also, you might have the tools, but from a user's perspective, do you trust the data? Is there governance of that data? How something is calculated, how a particular measure is calculated. Is it done in the right way? And is it done centrally? So is there central governance in place which allows me, who's going to use this data, to have confidence in that particular data? The other thing we mentioned already is the myriad of different data sources to be able to bring that together to get a complete view of what's going on. And I think the third thing is about, as I mentioned earlier, that we consume data in various different ways. So, there needs to be a platform approach to being able to produce reports of that governed data in various different formats, whether it's a PDF or a PowerPoint. Have a dashboard available that I can drill into that particular data, consume that same dashboard on a mobile device, embed that same analytics content into another system that we've got in the organization. So the three things that really come to mind are governance, the data, and the platform.
Just layer on that. I mean, let's look at South Africa. We have 54 million people, 15% split public and private. And if you look at the majority of the public environment, hospitals, primary healthcare clinics, primary healthcare especially, you don't have that information system layer, right? You need that layer first, because now you need to start to absorb the data, start to model it with maybe other data elements in the environment. So the one thing there is we need to look at having that information systems layer at all the levels, so primary, secondary, tertiary. If you look at the private sector side, I mean, primarily the focus has been on administrative and billing applications. So the appetite for qualitative and quantitative data reports from a clinical perspective really hasn't come to the forefront from a private healthcare perspective. Why? A variety of reasons. There could be one of the reasons that we have seen in the market. One is cost. One is skeptical providers. Changing the mentality and personality of the providers, of sharing of information. Most of the providers tend to keep everything in and say it's my kind of data element. It comes down to the question, who owns the data? Personally, I think the patient owns the data. So you have the human element as well, that one needs to look at. And I think that we are at a cusp of that informatics maturity in South Africa. And I do think in the next 5 to 7 years, we will see an appetite for more clinical-driven reporting. Obviously, where the influence would be on outcomes. Just to finish off, someone asked a question: will machines replace humans? So I had the privilege of heading out to Humber River Hospital. That's in Canada. It was voted the most wired hospital in North America. And if you go there, if you go to the A&E side, you actually have a robot that does the triage and does everything, picks up all your vital signs, pulse oximeter, etc., etc. But what's interesting in that hospital is you go to the NOC or the command zone, you have probably 10 data analysts sitting in the CIA room with probably 50 screens looking at every element of data that is churned in that hospital. I mean, I found it extremely fascinating.
Great. Well, thank you. I think we've already highlighted some of the challenges in this sector already, getting the integrated systems into place. Yeah.
If I could add, though, the challenges are real, but I think we're reaching a point. If we're not, in our case, we're there already. It takes a couple of years of trying something, and yes, there's always early adopters in all innovation examples. So it's called there was a book written called The Innovator's Dilemma, and Crossing the Chasm, that talks about the challenge of innovation. And that's true. That's true. It's kind of internet and software guys like me grew up reading this stuff instead of going to Sunday school. So it becomes DNA. But so that's true. But we're at a point. If you look at the stuff that the panelists are talking about, we're at a point where we can issue guarantees and say we can prove using millions and millions of records collected over a short space, let's say a year to 4 years, or whatever in our case, that these things are true. We can prove that will help you improve visit attendance. We'll prove that we can help you improve patient satisfaction. This is in our case. In other cases, we will prove we can assist successful diagnosis and so forth. So we can prove that, or your money back, or don't even use it. These are guarantees we can issue. And I think then the bigger question is, so I think the skepticism has been bred over years where, it's not the 1980s anymore, it's not the 1990s anymore, where a lot of this stuff was talk and it didn't work. And we talk about machine learning, they say, how long away is AI? It's 10 years away and it always will be. There's that old saying in software. But a lot of stuff is here now, and I think it would be great to continue an open conversation with the healthcare industry at large and allow the companies providing solutions that are backed with hard data to make bold statements that they hang their hat on and they put their risk on. And I think that reduces the adoption risk and the innovation risk dramatically for the purchaser or the people who need to adopt it. And so I think maybe in a year or two we'll move past this whole innovation is a big problem. Maybe it'll become a source of great excitement for
industry. That's the entrepreneurial optimism, which is great. But it's all about value in the end. We are running out of time, but I do want to give the person with the patient question there the opportunity to just ask his question, and then we'll have a quick comment on that, and then we'll have to wrap it up.
Yeah, my name is Dr. Andrew Sowanyo from Dr. George Mukavi Academic Hospital. The concern in the public sector is mostly around integrity of data. Is the data that is being collected reliable? And that's one area where we face a challenge, because if you put garbage in, then you always get garbage out. To be able to interpret the data, it has to be reliable. And one of the areas is in terms of how the data is collected and who collects the data. In my experience, most doctors are actually very poor at documenting what they've done and in relation to a patient. And there has to be a change in mindset as to how much information is collected and put down on paper. And when we are in the transition from a paper-based database to electronic data capturing, there are usually issues around who actually inputs that data. Is it the role of the nurse to collect the information? Is it the doctor's role? Is it the clerk? The doctors are usually concerned about getting through with their patient, giving him what they want, and going on to the next patient. So when it comes to inputting data, and there's a duplication of the electronic as well as the paper-based, then that becomes a challenge. And ultimately, you end up with data which you're not sure whether it's actually accurate or reliable. So we need to come up with checks and balances that actually make sure that this data is accurate and can be used to come to decisions about patient care.
Great, well thank you. I think that was a comment more than a question, which is very good and useful, because it does remind us about the fact that our data analytics, our predictive analysis are just as good as the ground truth data that we have at our disposal. And we need to ensure that there are good metrics in place that can monitor the quality. So thank you very much for reminding us that. At that point, I'm going to thank our panelists for the really insightful contributions. I think it was very interesting, at least for me. And I certainly learned quite a bit. And we are excited to see how this is going to grow and influence and add value to the health system in South Africa, but also obviously on a global sphere. Thank you very much.
Thank you. Thanks very much. Give our panelists a round of applause. Thank you very, very much.